I'm Julia Allison, and I'm here with Nicholas Stedman, licensed acupuncturist and herbalist, and he's going to answer all of your questions about acupuncture. Catherine Hall PR asks on Twitter, is acupuncture a good tool to stop smoking?
Yes, it is a good tool to stop smoking. However, smoking is it's a unique ailment in that it's largely behavioral. So acupuncture is good for treating the withdrawal effects of smoking, and it's also good for the withdrawal effects of hard drugs. So it's been used in rehab centers for heroin addicts. It can help to reduce the cravings and the nick fits, so to speak, but it needs to be followed up with some behavioral understanding, some understanding of how they're going to not smoke. What are they going to do during that time when they usually reach for a cigarette? How do they short-circuit their normal mode of being? So the acupuncture does take away the urge to smoke chemically, but the habit of smoking, you don't feel like you need a cigarette, but you reach for one anyway, or what do I do with my hands now? Those types of things they need to be addressed through more behavioral means.
Next Twitter question. Are there acupuncture techniques that can boost the body's serotonin levels or their dopamine production?
Yes. Basically, dopamine is for focus, and acupuncture can greatly enhance somebody's focus. Serotonin is more about feeling good, feeling good about oneself and where they are. This, as well, is done through acupuncture. We don't think about dopamine, serotonin per se. We're thinking in more traditional terms, but the end result is a changing of the brain's chemistry.
Our next Twitter question is from CL Rochelle, who asks, is acupuncture something that you can do once and you're free of pain, or do you have to go to it multiple times until you're fixed?
Well, both. You can, in some acute situations, you can come and that's it, the pain is gone. But for a more chronic issue or for a more serious issue, there is progress made in the first visit, but return visits are necessary. I would say roughly 8 treatments is a general rule of thumb, but for most pain issues. But by the 3rd treatment, there should be a change noticed, often by the 1st, but if by the 3rd or 4th visit no change has been noticed, then either switch acupuncturists or acupuncture isn't, and basically if it's pain, then acupuncture is always going to be helpful.
Can you really knock someone unconscious with an acupuncture needle like in that one Jet Li movie?
Yeah, you're talking about Kiss of the Dragon. You know, I wish it would be fun. If you had a thick enough needle, you could do some nerve damage. But in that movie, you know, blood won't come out of your eyeballs, and it's never been used martially, to my understanding.
Our next Twitter question is, how do you choose a good acupuncture practitioner? What are the best questions to ask to determine whether they're good or bad?
Well, the best question to ask is, do they also do herbs? If they are not trained in herbs, if they're not board certified, then that's not acceptable. The best acupuncturists are ones who use acupuncture as part of a holistic traditional Chinese medicine. Acupuncture by itself is just it's one tool in the tool chest. And if all you have is a hammer, all you see are nails. It's the more tools you have, the better.
This is my favorite Twitter question so far. Pet acupuncture. Is it real? Does it have benefits? Lily Dog needs to know.
Well, if Lily is in pain, then acupuncture can be very good for her. It's been used on racehorses, on camels in the zoo, in New York, actually. And you know, when you see an animal stop limping because of the acupuncture, you know that it's not a placebo.